knows exercise is really important to our healthy life, but you might don't know exercise is also a really important treatment for the patients who have depression and anxiety. But you have to meet few standards. Today we invite Dr. Jian Jianming to our studio. We will talk about this topic today. Dr. Jian Jianming, really happy to have you in our studio today.
Yeah, glad to be here.
So we talk about you have to meet few standards. What is the standard?
Last time we talked about engine oil leak. We realize the serotonin similar like engine oil. So engine oil have to be in the engine. If the leaking away, will not be working. Serotonin also supposed to be somewhere in the brain. If they keep reuptake away, will not be working. Zolnafil Prozac actually act similar like stopping fluids, just stop leaking of serotonin. Once you use Zolnafil Prozac, stop the leaking, but doesn't mean your brain have enough in serotonin. But right now, we don't have medications to increase those production. Like we mentioned, we have to rely on what? Fasting or exercise. That is the reason we need exercise to increase more production, increase serotonin, norepinephrine, dopamine. Right now, it's very common people confuse with physical activities with the exercise. You can argue physical activity, exercise is kind of physical activities, but the key word is intensive physical activities. That's what we call exercise. When we talk about exercise, when we talk about intensive, yes, there are 3 criteria you have to meet. Let's ask you one question first. Do you consider exercise is important or not?
Yes, it is important.
Why exercise is important?
I feel like exercise can make my body healthier and bring me more energy.
Most people have the similar thoughts like you do. They feel exercise can make them more energetic, can make them physically, mentally healthy, can prevent diabetes or depression or anxiety. But this is misconception. Why? It's because when you feel good, you're mentally healthy, can prevent of disease. That is results, not really reasoning. You can argue. Those good results can reinforce the behavior exercise, but still it's results. Almost everybody knows exercise can make them feel good, can make their body healthy. But why so many people ignore the exercise? Many people actually reject the notion exercise can make you feel good. It's because exercise initially actually can make you feel worse. Also, many people realize when you go to exercise, initially not to make their eat more, lose weight. Actually, they eat more and they gain weight. They realize, no, this is not true. So that's why so many people ignore the exercise. You ask people around you, how many people go to gym regularly? Very, very few. Why? It's because of misconception. The exercise is not really making you feel good. It's not really make you feel mentally, physically healthy. The really reason actually surprisingly similar like when you take medications. Do you remember last time we talked about we take Zoloft, Prozac? So for what reason? To decrease leaking of serotonin. The exercise actually is basically to increase production of serotonin. And that is the reason we go to exercise. Exercise actually not just increase production of serotonin, also increase norepinephrine, dopamine, endorphin, melatonin productions. They can increase much more chemicals production than any medication can do. So I often regard exercise is basic treatment that God invented. Many people ignore the exercise actually miss this basic treatment. So that's the reason we need exercise. So let me emphasize. Reason we go to exercise is not to feel good. It's not try to make our healthy mentally and physically. It's really reason to increase productions of serotonin, norepinephrine, dopamine. When you understand the reason we go to exercise, then you understand why we need the intensive exercise. So because research found out if you are just mild to moderate physical activities, like you just walking around, actually is not increased production of those chemicals. You actually consume the existing chemicals. That's actually why people feel tired and eat more. So this against our intuition about why mild to moderate exercise, physical activities will not help. And many people assume they go to walking around is exercise. Actually, they're not really exercise. So this reason we emphasize you need to meet certain criteria. Another reason is why we need to meet certain criteria is because when we talk about these benefits, like eventually we can increase the production. You know, we practice medicine is based on evidence. In the clinical research, we usually divide the patients into, for example, 3 groups. One is intensive group with intensive physical exercise. Another is mild to moderate physical activities. Another is sedentary patients, just sit there, don't do anything. So how do we divide those 3 groups? We based on we call maximum oxygen consumption. Maximum oxygen consumption, we've talked about is your same gender, same age group, typically can consume how much maximum oxygen in 1 minute. If we want to say you are really exercise, we need to say you have to consume your 75% to 80% of maximum oxygen consumption of your same gender, same age group. You have to meet that criteria. We can call intensive physical activities. Mild to moderate is between 75 to 25%. Now, below 25%, we call sedentary lifestyle, just sit there. So we based on this research, we prove exercise, intensive physical activities can decrease appetite, can lose weight, can decrease glucose, decrease cholesterol. That's research proven. So now we understand you have to meet this criteria in order to get the benefits that we proved in the clinical study. So in the research, we check maximum oxygen consumption, which is in the laboratory, which is not practical. In the real life, we recommend you monitor your pulse rate, heartbeats, which can be proportionally to the oxygen consumption. For example, at your age, we recommend you have to reach your 80% of the maximum pulse rate of your same gender, same age group, like 150 beats per minute. But we also recommend you have to 30 minutes, have to 5 times a week. Why this reasoning? It's because you know, if you want to go to work, you have to work for your boss. It's 8 hours a day, 5 days a week. If you don't, your boss will not pay you for salary. Similarly, if you just exercise for about 5 or 10 minutes, then you stop. So your body just cannot produce enough chemicals for next day. Also, why 5 times a week? 5 times a week, like in the past we talked about, any chronic conditions, like diabetes, high blood pressure, and antidepressant, you have to take 80%. It's because once we increase the production of chemicals like serotonin, norepinephrine, dopamine, they're not staying in your body forever. Usually about 10, 15 hours, it's gone. So you have to take medications equivalent to 5 times a week. Now, let me give you another analogy. From a distance, you see a factory. You can see smoking, you can see noise. Then you can see the factory is at working. But you see this factory, there's no lights, no smoking, then you know they're not working. So actually, when we talk about your pulse rate, we also talk about your sweating, trouble breathing. Those actually are indicators your body is working, is producing those chemicals. So similar like we based on those indicators indirectly to say your body is produce the chemicals. So that's why it's important we emphasize you have to push down your pulse rate to a certain degree. You have to feel sweating, heart pounding, otherwise you just cannot get the benefits. In average, at least 30 minutes, at least 5 times a week. That is then you can get benefits, including decrease your appetite, lose your weight, protect your heart, and it can kidney and brain. In the future episodes, I will present more more concrete scientific evidence to explain why you have to do that.
Thanks for answering all our questions today. And please don't forget to subscribe to our channel so you won't miss our following videos. Thanks for Dr. Jason Jian comes to our studio again.
Yeah, I'm glad to be here. And if everybody wants to know more about depression, anxiety, attention deficit, or opioid dependence, please contact my office.